as we mentioned, what the Health Secretary, Wes Streeting, has announced an independent investigation into the NHS's performance. Figures out this morning show that the waiting list in England increased to 7.6 million treatments in May. Well, I'm joined on the line now by Dr John Puntis from the Keep Our NHS Public Group. Dr Puntis, thank you very much for joining us this evening. I mean, I presume the idea of a review into performance is something that you would welcome.
Yes, in many ways, although I would point out that the last government commissioned an independent review into why the NHS was not working back in 2022 from the King's Fund. And the King's Fund identified lack of funding and the workforce crisis, too few staff, too little equipment and outdated buildings as being the major causes of NHS.
And most of that does all come back to funding, really.
Yeah, a lot of it comes back to funding. But look, if Wes Streeting says he wants to make a diagnosis, so if he wants to do an in-depth analysis of what's gone wrong, that's fine. But if he then wants to prescribe a treatment, these days that needs to be evidence-based. So we don't want the kind of solutions which have been tried and have not worked in the past. And by that, I would include things like using the private sector through the independent sector treatment centres. PFI was a big disaster. I wouldn't like to see that coming back, even though there is some discussion about that. And some of the things which he's saying at the moment don't seem to be evidence-based. For example, giving GPs more money. Okay, that's a good idea. Taking it from the acute service that's really struggling at the moment, as these figures show, is a terrible idea.
Broadly based on what you've seen so far in the case of what's been in manifestos and what's been talked about, are you more confident about the situation that the NHS is facing under the new government than you were under the last?
Yes, I am. I think there's some things in the manifesto to be welcomed, but they're actually very limited. And I think that the NHS really needs funding above everything else. You know, reform is not going to cut it. And I don't think you could significantly improve the current situation without investment, and particularly capital investment, and without investing in staff as well.
The government have got to ride a line here, though. And much as most people in the NHS would welcome more funding, there's a limited amount of money available. You've said that the idea of private investment is not one that you would welcome. So, I mean, the money's got to come from somewhere.
Well, government can find money. I mean, they're not like you and me and have to dip into their personal bank accounts. And, you know, we saw this in the banking crisis when masses of money was made to get the bankers out of a hole. We actually saw it during COVID when more money for the health service. But
the argument would be that they've also got to find money for defence, they've also got to find money for education, they've also got to find money for social care. I mean, there are an awful lot of challenges this government is facing.
Yeah, there are challenges. I think they need to get their priorities right. And if they're committed to improving the NHS, then I'm all in favour of them understanding the problems in detail, but I think that they will come back through any independent review. I think they will come back with the answer that it needs more funding. And I hope they won't come back with the answer that the kind of things which were done under the Blair-Brown government when Lord Darzi was a minister, that those things are going to be repeated, because those would be mistakes from the past. We don't need to run those again.
Dr John Puntis from Keep Our NHS Public, thank you very much for joining us this evening on LBC News.